We were just outside, Dr. Campbell and I were speaking, and I'm so happy to have Dr. Weiss join us because we are here at Ethos Health and Organic Farm, which is a really interesting dynamic of where you're bringing the patients to the plants that can heal them. And it sounds to me that a lot of your work was inspired by Dr. T. Colin Campbell.
It was, yeah. I remember, I began my journey, and a lot of the times we watch patients when they're introduced, or people, even who are not sick, they're introduced to the idea of eating plants, but then you watch them, they usually don't adopt it immediately. Sometimes they adopt it 3 years later, 5 years later, 10 years later. It can be a long journey. My journey started like about 15 years before the China study with my father's sickness. He had cancer. I saw what plants did for him. And then when the China study came out, I sat up reading that night after night. It took me about 3 or 4 nights. I worked during the day, and I'd stay up until 3 o'clock in the morning reading that and dog-earing the pages. And when I closed the book, I decided I had to completely change the way I was seeing patients. And it was this concept that Dr. Campbell talks about, emphasizes in the book, about the holistic approach to health, and how you don't get health from just taking a pill, or it's not defined by a molecule. It's defined by complex interactions. And in the world around us, in the natural world within us, in the body, biochemically, and then that connects to all the forces that surround us. And because I was, at that time, and for most of my life, always hell-bent on getting a farm, it inspired me to then put what I knew about a doctor into the farm and then put them together and connect human health to the farm format. And it was because of it really gelled with me after reading that book, the way this comprehensive idea about health
And nutrition.
supported, human health.
It's really interesting to have both of you together because you're representing, the biochemistry and the research. And then Dr. Weiss, you're representing putting it into action as you're a primary care physician.
Yes.
And you're seeing patients here like I would go see my normal doctor, except for your approach isn't to immediately get out your prescription pad and write out a prescription. Is that correct?
That is correct.
How do you actually put the science into motion and into action?
We have a regular, like a full service regular, I don't think it's regular, but a primary care practice. And we take any human being from a day old or before they're born to, 100 years plus. And we pride ourselves on being able to take people who are not sick and prevent their chronic diseases. And then if they are sick, reverse them and get them off their medications. Through the China study, a lot of diseases, almost all chronic diseases are preventable and most of them reversible. So most of the people who come to find me, they don't find me by accident. They already know I'm a little crazy. So they know why they're coming here. So they're actually not geared towards wanting medications. But once in a while, if there's somebody who needs something, I will have to write a prescription, but it's rare.
I see.
I think for the first time, I wrote a prescription for a statin agent, probably in 3 years.
That's awesome.
For Lipitor.
I mean, that's great that this isn't common practice here at Ethos Health.
Yeah.
And along those lines, I just heard a recent talk that you had with Physicians Committee for Responsible Medicine, and you were really addressing chemotherapy, and that if we could prescribe a whole food plant-based diet to patients, a lot of them would see positive results versus opting for chemotherapy when treating cancer.
Yeah, that story comes in bits and pieces. We still got to put some of it to knit it together in a sense. Heart disease, as we know, and our colleagues have done this, reverse heart disease is pretty much of an easy deal. Diabetes also. Cancer has been regarded as I say in old money, inexorable kind of disease. Once this starts, it's going to keep on going. You might alter it here and there. And so, and that's such a rigid belief that we never, in research, have really done any serious work, not very little, of actually taking cancer patients and then try to treat them with this disease. My youngest son, Tom, he's now got a study underway on metastatic breast cancer in women. And he's been underway now for about 6 months or so. It's not completely as it should be because he had to do it very efficiently. He's at a medical center. So he had to get IRB approval, 6 IRB approvals.
Wow.
It was, the hurdles he had to go through was incredible. But they
Just to feed people.
I'm sorry?
Just to feed people plants.
Yeah, and so, you know, that's right. And so he's now got it underway, but he couldn't do the whole thing the way I had wanted him to do it. And that is to say, they wouldn't allow patients to just try the diet alone without the chemotherapy. They wouldn't allow that. Because we already know the chemotherapies, it can do all these wonderful things. Why would you want to do that? You know, that kind of, so they blocked him from having that arm of the research study. But what they did allow him to do is to take women who had metastatic breast cancer, it's returned, and then let them continue on their regimen, but just put them on a plant-based diet. So it's a limited study right now, but he's just getting his toe in the water, because if he gets the results that are good, then he can go to NIH, and that's where I did a lot of my stuff. Then he can get substantial funding to really, then he'll have the data to say, look here, and they can't really turn him down. And then he could do the full process. But the reason all that happened is because all these years, I've been in the cancer community and nutrition too, there's no way that the oncologist would ever give even a hint that diet could work. Don't bring us crazy ideas to us, that kind of thing.
Even to this day, when we have cancer, a lot of cancer patients come to us because, you know, because of my father's story, that he had the stage 4 cancer, and because they're desperate, because chemotherapy is not working, and they're trying alternative anything to help them. And
chemotherapy is not enjoyable whatsoever.
No, and it can kill you, or it can cause permanent dysfunction in you, which makes the rest of your life, whatever you have left, unenjoyable. Well, so the number one thing, the history that we get from patients when they go to the conventional oncologist, and it doesn't matter even if it's at the most ivory tower academic center, because I think it's a natural thing for a patient who has cancer always to say, doctor, what should I, you know, because there's some inclination, well, maybe I should eat better, you know, and they ask the oncologist, what should I eat? And the standard answer is, it doesn't matter, just whatever it doesn't matter, whatever you want, or, you know what, why don't you see our dietitian, because we have a cancer center, the dietitian will tell them to eat lean meats, you know, non-fat dairy products, low-fat dairy products, and eat more vegetables. That's the standard. And on top of that, and avoid soybeans.
Oh, okay.
Yeah, if you have breast cancer.
How does a person navigate this world of misinformation regarding nutrition and food and health?
That's what I try to tell them in this new book I have, was exactly that question. You know, why is nutrition so confusing for the public at large and amongst professionals too? And why isn't it not taught in medical schools? Why has it just been written off, as if it, you know, didn't matter? Yeah, and I think that story is, I find it very exciting. We chose the wrong path. We could have gone this way or that way. We picked the wrong one.
Is there hope that we can curve it around?
Yes, of course. Starting with something like what you've done. You know, these kind of efforts where you can bring some professors together and, you know, regional people. You got to start with people who are willing to, you know, converse and be civil about it. And a lot of them aren't. But we'll have to keep plugging away. I think, I'm biased in this case, but being in science, but I really think that the word nutrition is not understood. That's part of the problem. A lot of people aren't deciding what nutrition is based on the science because a lot of people don't even look at the science. But they do pick up little pieces and then argue about it. So the whole mess is such a I think we get the science properly defined, nutrition properly defined, especially with some of the authorities.
So
You know,
if thinking just about nutrition, are we able to find nutrition through supplements then? Or
No.
do we need to go to a whole food and really eat it in its true
Whole
form?
food.
And why is that? If science has then developed ways where we can extract and like what
Yeah,
seems to
but
optimize
We got
nutrients?
some, in my talk today, we got some really excellent studies now, very convincing, where the so-called responsible nutrient in the food that might be associated with less cancer, less heart disease, they took it out and put it in a pill.
Mhm.
When you do it that way, it doesn't work. When it works in the food in one form, it does not work when it's in isolated form. That's where the concept of whole comes from. Everything is having to work together. You can't take one thing out and expect to get the same effects as you do in food.
Seems like nature just got it right.
Nature got it right. That's exactly right.
What I like to tell patients, because a lot of patients come in on supplements, and I think it's so attractive because the promise of health from just taking this little pill is so attractive.
That's
You
right.
know, it's
Magic
easy to
bullet.
do. You can just feel better, just pop something in your mouth. That's why, pills are popular. They don't take a lot of effort. But what I tell the patients is that a supplement is actually a drug. What is a drug from a pharmaceutical company? It's a copy of a molecule that's reproduced millions of times over and over again, and it's targeted to a specific biochemical reaction into a cell to interfere with it. Well, when you take, vitamin C or some other supplement molecule, you're taking a large amount, or even if it's a plant molecule, let's say resveratrol, you're taking this copy over and over and over again, and you're introducing it into the system, which will then most likely interfere in an unexpected way with a biochemical reaction, which will then cause an unexpected chain of events from all of the other myriad chemical reactions that are hooked up to the one you just cut.
When we're talking about, extracting and interjecting these molecules back into our bodies in a different way, that really makes me think of oils, like olive oil, or now coconut oil has become such a huge craze. And they've been touted with, good popular diets like the Mediterranean diet and things like that. But then I hear information that we need to eat the whole food and fruit versus going to the processed oil. What are your thoughts on that? And is that just another example of how we've extracted a molecule and are trying to reintroduce it into our body, and it's not whole form for it to interact correctly?
Basically, I think in the simplistic form, the oils that we need to worry about are the added oil, yes, but it's the oil that, in fact, in large measure, is the so-called omega-6s,
Omega-6.
like corn oil and stuff like that. And
Soybean oil.
yeah, and the so-called omega-6s are pro-inflammatory fatty acid. The omega-3, which is the counter, is an anti-inflammatory. And so it's the ratio of the two.
Keeping
The body
balance.
uses the ratio very nicely because it needs some omega-6 when it's wanting to fight off something or whatever.
Mm-hmm.
But the ratio matters, and the ratio, generally a good ratio with a good diet is like 2 to 1, 3 to 1 maybe, of 6 to 3, somewhere in that territory. We're now at an average in this country of like 15 to 1 to 20 to 1. It's awful. So we're consuming a diet you can describe as a pro-inflammatory diet.
And those omega-6s that Dr. Campbell is talking about are preferentially found in atherosclerotic plaques. It's the most common kind
That I
of
didn't
fat
know.
that's found in an atherosclerotic plaque. And recent experiments have shown that when LDL, the bad cholesterol, gets damaged and very reactive, it's triggered, that damage is triggered by the omega-6, by the linoleic acid. It starts off its very activated and reactive process, which then, causes atherosclerosis. And all of that comes from all the oils you see that are flooding the American, palate. The safflower oil, the soybean oil, sunflower oil, all these oils that end up in our
Our
food.
food.
So it's not good to have the added, so-called added oil, in isolation. That's why we say, no oil.
The coconut oil, I know there's this craze about it now, but that's particularly toxic for another reason. It's because it is extremely high in saturated fats.
And that's why when you look at it on a shelf, it's
Yeah.
dense, just the same as
Yes.
animal fat is dense.
Worse, that if you take an ounce of coconut oil, it has more saturated fat than an ounce of lard. You're better off eating the lard.
I've got a slightly different version on that that we're going to have to get ourselves updated on.
Okay.
The saturated fat is not very chemically reactive.
Yeah.
And it got blamed for a lot of the problems over the years, like high cholesterol level, for example, when it should have been the animal protein that got blamed. That was learned over 100 years ago.
Oh.
So the saturated fat has turned out to be the surrogate excuse, for not paying attention to the animal protein. That's something new. We'll talk about that.
But saturated fat,
It's associated with heart disease, but it doesn't necessarily cause it.
yes, but we now know that it does. It is most likely the cause of diabetes. In that it is toxic to islet cells. It kills them. Saturated fat is toxic to them, and it interferes with the action of insulin and its ability to get sugar into the cells. So in that way, it's not good for the development of diabetes. I hear what you're saying about the elevation of cholesterol.
in heart.
And
Yeah, but
cancer, it's a cancer too.
yeah,
It's good for
but-
cells.
because it may increase eating that fat, the saturated fat may increase IGF-1 levels.
Yeah, I don't know that. And,
Where's the
think so.
scorecards right now?
I think so. We'll have to look up that.
This has to be a different place.
Well, I really enjoyed your time today, and I just want to end with something fun, which would be, I've spoken with Dr. Michael Greger, and his favorite plant to eat are legumes, and I'm wondering, what are your favorite plants and vegetables or fruits to eat?
I'd like to say I don't have a favorite because it's a whole mixture. I want to keep my options open. So lots of greens, lots of legumes, lots of whole grains and so forth. I don't know. I don't know whether you have a favorite or not, but I like broccoli.
I like being on the farm here. I generally like all things for some reason. Well, I know what the reason is. I hate Brussels sprouts. I'm like the George W. Bush of Brussels sprouts. I have to tell you that. But other than that, and I know how good they are for you, but I still don't like them. Other than that, I like everything. But at certain particular seasons, there are certain choices that I like which become extraordinary. Like at this time of year, when frosts come, to kale, which withstands cold weather like this and actually becomes a superstar. After working through the whole summer, the kale takes off after the frost. The frosts encourage the plant to start manufacturing more natural sugars, like as an antifreeze, so the plants can live through these colds. And then you taste these sugars, the kale becomes very sweet. And so I love kale at this time of year, all the kales. And Osaka red mustard greens.
Mustard greens.
Osaka red.
Oh, I like that too.
Yeah, beautiful.
Yeah.
I'm getting hungry.
From a distance, it's like, what do you eat? Well, just fruits and vegetables, that's all. It's like so simple. It's like fruits and veg, you're just eating fruits and vegetables. But then when you actually try to break it down, and we're so detached from what a plant-based diet is traditionally that nobody even knows where to begin.